Today, confirmed of new cases are 38, lowest in 3 weeks. คุณเทพชัย
Yes, it's very encouraging sign indeed. I mean, even though it is not confirmation that we have turned the corner, but this continuous trend of the number of infections coming down. And today we have 28 cases. I mean, this is remarkable. But of course, it's something that we should be glad about, but not something to be too overjoyed with, because we all know that the bigger challenge is ahead of us.
Yes, for the number of new cases, 28 today. State quarantine in Stun. These are 2 cases found from state quarantine in Stun and 1 in Yala. But still, even though the new cases, 28 is the lowest in 3 weeks, we all have to keep stringent measure intact, especially with what Dr. Taweesin Wisanuyothin, spokesman of COVID-19 Center, have told us that the guard has to remain quite high, and we cannot underestimate the whole situation of COVID-19 in Thailand, คุณเทพชัย even though the downward trend is appearing in front of us, but we still have to keep all the measure intact.
Yeah, when we were talking earlier about the bigger challenge ahead, we were referring specifically to a large number of Thais who are on the waiting list to return to Thailand from overseas. Many of them will be crossing the borders from neighboring countries. And of course, these people are now a major source of concern for medical authorities. And they are taking a lot of precautionary measures to make sure that these people don't come back in big groups at once. They should come back gradually, and then each will be subject to a state or local quarantine to make sure that they do not spread the virus if any of them are infected.
That's right. And if we take a look at the whole country, Phuket is the most intense rate of infection. According to the statistic that they have compiled, per 100,000 population, Phuket has the rate of infection of about 44, which means the most intense area of infection in Thailand. Even though if we take a look at just the number of the cases, Bangkok has more cases than Phuket. But if we compare with the population of 100,000, Phuket is the most infection rate in the country, คุณเทพชัย
No questions, Phuket is now posing the biggest concern for medical authorities. If you remember, in the last week of March, Phuket had only 1 infection case. And it was something that we welcomed as good news back then. But within 1 month, a lot of changes have taken place. Now, Phuket has become the province with the highest rate of infection, considering the small size of the population of the island province. And it was not until April the 4th that medical authorities in the province began the so-called active testing, focusing on 3 particular groups of people. One of them were people who were related to entertainment businesses. And then the other group, the second group, is a group those who have been in contact with the people who were infected. And then the third group are the so-called high-risk group. These are people that are sort of have been in contact with foreigners or involved in businesses that would expose them to contacting the virus. And another problem was, Kunatha, as pointed out by Dr. Taweesin, spokesman today, that almost more than half of the infected person didn't come to seek medical checkup until after 3 days. Some of them came after 7 days. So that means that many of them might not have shown symptoms at that point. But once they were checked up and then found to be tested positive, then it was a bit too late for people to react.
Yes, and if we take a look in the past 2 weeks, the cause of infection in Thailand mostly is from transmitted from previous case. That's the number one of the new infection in Thailand. The second is Thai returnees, Thai who return from abroad. This is the second most cause of infection. And the third is risky occupation, like people who still have to work in the indoor facility and having close contact with others still remain as risky occupation. And the fourth is medical personnel who are fighting the front line are the most people who likely to be infected of COVID-19. And the fifth is people who still work in entertainment venues. Even though the order has closed all the entertainment venues, but the risk still remain from the previous situation คุณเทพชัย
Once we begin to see the infection cases going down in number, then many people will start asking whether or not some of the stringent measures that have been imposed, including the curfews, should be relaxed. Of course, the medical personnel who are heavily involved in the fight against this deadly virus caution against any early relaxation of these stringent measures because they believe that these measures are largely responsible for bringing down the infection number. So if they can have their way, they would rather see all these stringent measures to be in place. But of course, the government may have different ideas. And according to reports that we have today, some of the committees responsible for working with the government in designing these stringent measures have been also assigned to find out whether there could be possibility of some of these measures could be relaxed.
Well, but for the time being, it seems that we still have to keep our guard high to have stringent measure right now in order to cope with the situation. Because if we relax today, the number of infection perhaps won't increase tomorrow, but it will take time like 4 or 5 days at least before the new trend or the new group of infection is being shown in the next 4 to 5 days. That's why we still have to remain using stringent measure for now.
Yeah, I think the message from the Prime Minister is clear that he still has no intention of relaxing these tough measures yet, because he believes that it was because of these measures. That's why the number of the new infections has been gradually come down.